U.S. coronavirus vaccinations are slowly ticking back up again. Nearly 40% of the population is fully vaccinated, and almost 50% has received at least one dose. And while health officials say we may need booster shots in the future, many states are still working on convincing Americans to roll up their sleeves for the first round of shots. Mola Lenghi reports.
Tonight, Dr. Anthony Fauci says the pandemic will be under control in the U.S. within a few months, but with a warning to get the vaccine to as many people as possible worldwide.
Not only do I think it's a humanitarian moral responsibility, but it's in what I call enlightened self-interest for us to do that.
There's been a nearly 20% drop in average daily vaccinations since early May. Now, some states are rolling out incentives to get residents to roll up their sleeves. 5 states now have cash lotteries. Colorado is the most recent, offering $1 million to 5 vaccinated state residents. Yesterday, Maryland had its first $40,000 vaccine lottery winner. And in Ohio tonight, the first of 10 Vax-A-Million awards. 5 vaccinated adults will each get $1 million, and 5 vaccinated teens will get a full state college scholarship.
What do you say to the folks who say financial incentives are maybe the wrong way to try to motivate people?
If giving this chance of winning $1 million gets them motivated to go get it, then it certainly is worth the money.
And it appears to be working. After announcing the promotion, there was an increase in vaccinations. Brandon Scotch was slow to sign up for a shot until he saw the money.
It was a motivator to, get the shot and, hopefully hope for the best.
Today, the governor of New York announced the state's latest vaccination incentive. Any 12 to 17-year-old state resident who gets a shot will be entered into a raffle to win a full scholarship to a state university. Lana?
Mola, thank you. And Dr. Richard Besser joins me now. He is the president and CEO of the Robert Wood Johnson Foundation and the former acting director of the CDC. Dr. Besser, always a pleasure. So we've got a little bit of good news because vaccinations are slowly picking up speed here in the U.S. after falling to a record low last month. What do you believe is driving this uptick?
Well, I think, Lana, there's a number of things going on. One is we were spoiled by the initial surge of people who'd been waiting and waiting and waiting to be vaccinated, and they finally had the chance to be vaccinated. And so we saw a big drop after that. But I think what we're seeing now is that more and more people know people who've been vaccinated, friends and family members, and they're seeing what people are able to do safely. The CDC is allowing people or telling people that the science supports more activity that you can do safely when you're fully vaccinated. And that, I think, is encouraging people to say, you know what, I want to get vaccinated and I want to get vaccinated now.
Do you think, just as a follow-up to that any of the incentives that we've been hearing about, the lottery system, the sports tickets, even like free drinks, do you think that that's actually contributing to it, or it's really just the people who are waiting to see how that first round of immunized people felt afterwards?
Yeah, I'll be interested to see what studies show in terms of incentives, because there's a wide range of incentives that are out there. For some people who are on the fence who are saying, you know what, I do want to get vaccinated, but I'm not in any rush. When it's convenient, I'll do it. But maybe when they see an incentive, they'll say, wow, I'd really like that gift card. I'm going to go do that. But there's also some concern that people don't want to feel coerced or bribed into doing something. And the sense of, well, if I have to be bribed to do this, is there something wrong with that? So I'm looking forward to the social scientists, the anthropologists who dive into this and say, you know what, of the things that were done, here's the things that were really effective, and here's things that we should never do again.
I'm really interested in seeing the results of that analysis as well. Speaking, though, of studies, the JAMA Network Open found that 73% of people who experienced moderate to severe COVID had at least one long-term symptom. Some experts have called these lingering symptoms a public health burden. What's your take on this?
Well, first, just a caveat. Most of the people in that study, they looked across 19 different studies. Most of the people were hospitalized, so it was a pretty severe population. What they found was that a lot of people still had shortness of breath and fatigue. What it says to me is that we really need to take this disease seriously. And although the vast majority of people who get infected will do well with this, there are a lot of people who are developing disabilities because of this COVID infection. And they're going to have issues that they're going to need to deal with long term. When you hear reports of, oh, COVID's nothing to worry about if you don't end up being hospitalized or on a ventilator, well, there's a lot we still don't know about this disease. In addition to what this study found, the chronic inflammatory syndrome that you see in some children, those are things that can be very concerning.
You're also a pediatrician, a practicing pediatrician, and the CDC, as you well know, has a list of recommended immunizations for children. But the head of the agency told a House committee hearing on Wednesday that an adult immunization structure is needed. I'm interested in hearing from you about whether you think that could work and what benefits that might be garnered from adult immunizations.
Yeah, I mean, there are a number of immunizations that adults get and should be getting. So the annual flu shot is one of those. A vaccine against shingles. When you get older, vaccines against pneumonia. Those are really important. In America, though, we're the only wealthy nation that doesn't ensure that everyone has access to high quality, affordable health care. So you see a lot of haves and have-nots, people who see their doctor regularly for an annual checkup and get their shots, and those who don't. It is critically important that we work towards a day when in America, how much money you make, what type of job you have doesn't determine whether or not you have health care and whether or not you have access to vaccines that can truly improve the quality of your life.
One other question while we're talking about children, the CDC is working on guidance for summer camps, and Dr. Rochelle Walensky says the goal is to make sure that they can stay open and avoid outbreaks. But obviously younger kids are not going to be vaccinated by then. How concerned should parents of younger children be, and how do we ensure that all kids can really stay safe while participating in activities that they may have missed out on last summer?
Yeah, I'm glad to hear the CDC is re-looking at summer camp guidelines for a couple reasons. One is that the guidance came out before there were vaccines available for kids 12 and older. The other is that there's more and more evidence that being outdoors is a really safe place to be. And being outdoors without a mask and running and just being a child is so important for emotional health, for mental health, for physical health. So I'm hoping that the new guidance isn't quite as restrictive as what we saw before. And parents will need to decide based on their own tolerance of risk and their child's own underlying medical health, how comfortable they are with their child in different situations. And you're going to see different people make different decisions. And you'll see some children with masks, and I expect you'll see some children running around and smiling without a mask.
All right. Dr. Richard Besser, as always, thank you.
Thanks so much, Lana.